name's Jo Parkington. I'm the CEO and a midwife of an organisation called Birth Like a Boss. And one of the main things to understand is a caesarean section, just because it's common now, in other words, over 30% of women, and that's an underestimation of it. And like I say, in some parts of India, it's 70%. So at least 1 in 3 women will undergo surgery. It is major surgery, and it really does impact on the woman's health. You are having major trauma to your body, and more importantly, baby is not designed to come through an abdomen to birth. Baby is designed to come through the birth canal, and there's many physiological processes that have to take place within the baby for baby to then be able to adapt to the outside world. And what those physiological processes are stimulated by a normal birth as baby comes through the birth canal and is given birth vaginally. So there's 2 things. Cesarean section, let's not forget, cesarean section is a major surgery, and you would not have and undergo major surgery without careful consideration to do that. And as well, whether you under a cesarean section, you will require an anaesthetic. And most commonly now, the anaesthetics that we give are through the spinal column, and they're called a spinal or an epidural anaesthetic. And that allows the woman to be awake during the procedure. Or we still give general anaesthetics, although they're not quite as common anymore. But we cannot underestimate the impact that an anaesthetic can have on a woman's ability to heal appropriately afterwards, but also the fact that it causes physiological responses from the woman. So a spinal anaesthetic, an epidural anaesthetic, causes a woman's blood pressure to drop significantly. And it also crosses the placenta quite quickly. So not only does it cause the woman's blood pressure to drop, it causes an impact on the baby as well, and the baby's heart rate will go down. Which is why once they commit to a caesarean section, the surgeon is committed to getting the baby out very quickly, within minutes. So there is a real consideration to be given to what we now class as a routine surgery. No surgery is routine. There is always a risk to surgery. So the risks are to you as a woman and the risk to the baby. And we also know that women who have their baby normally and go through the process of a labour and then a birth produce higher levels of hormones called oxytocin that help them to bond with their babies. It helps them to move into a nurturing role. And so giving birth is about not just the birth of a baby. Giving birth is about the birth of a mother. And labour and birth, the act of going through your labour and birth, is that process for you to give birth to yourself as a mother. And a caesarean section doesn't allow you to have that physiological transition that you need into motherhood. So it's really important that we understand that caesarean sections are safe. We are now, very few women actually die from a caesarean section, but they do have an impact on your physical and your emotional and mental health and well-being. Then there's also the risk after. So women do bleed after having an operation, a caesarean section, so the blood loss can be higher from a cesarean than it can be from a normal birth, which then obviously impacts later when you're trying to recover. And when you're trying to recover, you've then got a new baby to look after. So there is the impact of blood loss. There is the impact of potentially low blood pressure. And there's also the impact on mobility. There is a real risk after an operation, anybody that has an operation, on what we call deep vein thrombosis. So because of the drugs and because of the lack of mobility, blood clots can form. So after a cesarean section, because the woman is then classified as being healthy in any other way, you're encouraged to get up and move around as quickly as possible. But it hurts, having surgery and having a cut into your abdomen and then into your uterus hurts, and it can be very painful. So then you need increased medication, you need painkillers and medication following on, which then passes into the breast milk. So if you then feed your baby through breastfeeding, baby has the potential to get those drugs as well. So when you're considering having a cesarean section for a non-emergency, non-medical reason, it's really important that you understand the risks of a cesarean section and then also the benefits, because it's really clear that cesarean sections used appropriately save lives. So this is not about a normal birth at all costs, that women should be encouraged to have their baby normally at all costs. This is about understanding when it's safe to have a cesarean section. It will actually save your life, or it will save your baby's life, against the routine use of cesarean sections because you've gone past your due date, or because they've tried to induce your labour and you haven't been able to go into labour, so therefore the only way to get the baby out is by performing a cesarean section. So they're not valid reasons for undergoing major surgery. From a baby's perspective, they are designed to be born through the birth canal, and physiologically babies adapt to the outside world much easier. They transition much easier to living outside of the womb when they've been born vaginally. So there is massive benefits to you, and there's massive benefits to your baby to have that birth. And let's not underestimate that amazing feeling when you have given birth and you have gone through that journey and that process, that feeling of, because looking after a newborn baby and looking after a family is also challenging, and it's not easy in the world that we live in today. And often women will say, if I could go through labour, if I could give birth in the way that I did, I can get through this next stage of being a mother, of having to go through those first few months of a new baby and transitioning into motherhood with all the sleep deprivation and everything else that goes with that. So it gives women a feeling of empowerment, of that power that it is to be a woman and to give birth in that way. Challenged, I think, as midwives. The World Health Organization recognises that midwives are crucial to the health and to saving lives of women and babies across the world. And it's also seen in some countries, midwives are seen as very much the guardians of normal, the guardians of a normal natural process. In other countries, they're seen as handmaidens to the obstetricians. And, your experience of a midwife could be one or the other of that continuum, and anything in between. And sometimes a midwife is trained in an environment that encourages her to think more in a medical model, in a medical way. Or they have a firm belief, they come into midwifery with a firm belief that women can give birth, they are born to give birth, and it's a natural physiological part of life, and they're there to protect that and to be guardians of that. And sometimes midwives are under criticism for that, and it's believed that as midwives we will go for a normal birth over everything else. That is completely not true. We believe as midwives that women have the right to their own reproductive autonomy. They have the right to make the decisions about their body. They have the right to make the decisions about their baby. But you can only do that with the information and the knowledge and the understanding to do that. So it's not about giving birth with no drugs, with no pain relief, it's against everything else. It's about understanding what is right for you. So as midwives, we are absolutely not against women having, for example, an epidural. An epidural is an anaesthetic that is injected into the back, into your spinal column, the area around your spinal column, and it creates a numbness. It anaesthetizes from the waist down, so it provides absolutely pain relief when it works. It provides pain relief from the waist down, so women do not experience the pain of the contractions, and they do not for example, experience pain at all. But actually, as I've discussed around the use of using an epidural for Cesarean section, there are complications with an epidural. And what's really key to understand is that an epidural is a strong drug. It uses a strong anaesthetic drug, and that drug has an impact on the woman and it has an impact on the baby. But one of the other things it does, it prevents the woman moving around. We do have, in some hospitals, they do mobile epidurals. They could talk about mobile epidurals, but they're not as common and they don't always work. They anaesthetize too much. So it doesn't, the idea of a mobile epidural is that the epidural anaesthetizes the abdominal area, around the pelvic and the abdominal area, but the woman still has sensation in her legs, so she's able to stand and move around. That's not very common. It's not always, you may request a mobile epidural, but the anaesthetist cannot guarantee that it will be able to work in that way. So the idea of the mobile epidural is that the woman has the best of both worlds, because giving birth in a position that's more upright, it takes the pressure off the vein that runs at the back of the uterus, which provides the blood flow to the placenta, so that there's more blood flow to the placenta, there's more oxygen going to baby. The use of gravity helps the baby to descend and come through the birth canal easier, and the woman is using that gravity to help her to push and to bring the baby through. So an epidural can be beneficial, but it also comes with risks. And as a midwife, our role is to discuss the risks and benefits of any intervention, whether that's an epidural or another form of drug, and whether that's okay and appropriate for you. So an example of a really good reason that you may consider an epidural for non-medical reasons is if you have experienced trauma in the past, or if you have experienced sexual abuse in the past, sexual trauma. It can help to minimise the emotional impact of giving birth through that. So it's really important that we understand the reasons why women are requesting an epidural, how we can support that, and what we can do to support normality within that. the message that I really would like to talk about today is about becoming informed. And there is a lot of information available to women. Google is amazing. We can find pretty much anything. But it's applying that information, and it's having an understanding of the information and then being able to apply it to your own individual circumstances. So we have amazing access now to technology. We need to embrace that. We need to understand how we can use it for the benefits and the safety of women and babies. And the message I want to give to women is, please be informed, please educate yourself, and then please be in control as far as is possible for you to be. Please be in control. And that means consenting and making the decisions for you that's right for you. And we have some great resources at Birth Like a Boss. You can find us online. And we also offer virtual telehealth services to help support you with that decision making and understanding. So please find us, please seek us out, and please